Hi, this is Dr. Anderson from Anderson Podiatry Center and Anderson Center for Regenerative Medicine, and I'm here to talk to you about how we evaluate you when you come in with your heel pain. Heel pain, or what you would be commonly calling plantar fasciitis, is really one of the most common things any podiatrist is going to see. And one thing that we've been doing probably for close to 15 years now is we've been ultrasounding heels. When you come in, we don't just x-ray you, but we also look at your fascia with an ultrasound machine. And just in simple terms, these are diagnostic ultrasound machines, and some would call them a sonogram. But the idea is that you can look inside the heel and you can look at the characteristics of the fascia. And we're mainly looking at two things. How thickened is it where it attaches to the heel bone, number one. And number two, what does it look like? What coloration is it? Is it darker, lighter? What's it look like? So first of all, understand that when you have heel pain, the fascia connects to the heel on the bottom of the foot. The fascia runs from the ball of the foot to the heel, connects about right there. And as you step down, the pulling action of that fascia from the heel bone is thought to create a lot of this pain. So it gets enlarged. And we actually grade or rate your fascia when you come in, and we have this little handout that we give you. And patients really love it. They think this is really cool because we can actually rate from over here. These lighter colored areas would indicate not as severe, this is more severe. And basically, if you look at this, and it may be kind of hard to see, but across the top here would be indications of how thickened it is in millimeters. So this horizontal axis this way is how thick the fascia is. And then this vertical axis, this would be a light colored fascia, darker colored fascia would indicate the darkness. So the more darkness we see, the more severe the presentation, and the more thickness we see going from the left to the right, this would also indicate more thickening would be more severe. So we can really tailor our treatments to you specifically based upon the severity of this. Why? Well, we think the reason to do this is it helps you be engaged in your treatment, because seriously, if you're down over here, there's a higher probability that we won't be able to get rid of it conservatively. And in some cases, we have to resort to surgery. And it's not that surgery is a bad thing, because we don't have many problems with it, and it works a high percentage of the time. And you might be surprised how little layup there is, but most of you, and us too, we want to avoid surgery if we possibly can. So this helps us rate how you present. And besides using stem cell, which we use quite a bit, regenerative medicine, we oftentimes use orthotics, sometimes we may use laser. And this basically helps us to kind of prescribe a treatment plan for you that is more directed to where you are on the scale from mild to severe. So I hope that helps you understand how we put a little bit more science into this by looking at the fascia directly and actually quantifying where you're at personally. So I hope you enjoyed this content, and please, if you would, I would like you to comment if you have any, give us some feedback, and by all means, feel free to subscribe to your YouTube channel, and I thank you for your time.